Talking about, I know we can't talk about individual cases because of patient confidentiality, but for instance, we do know that our soldiers and sailors and airmen go to war zones and theatre, and we all know that they suffer great stress problems when coming home, and we know that the defence put them through what they call decompression. Does this help those type of people and help them with their condition?
Well, military personnel are put in a very, very unusual situation. Part of their occupation is that they go into high stress environments that can often be profoundly stressful, profoundly sort of competitive. And then we bring them back home and we expect them to behave normally. And for some people they can make that change, but for others, they can't. So even though our military personnel are trained now to a much higher standard than at any point in military history, they can still encounter profoundly distressing experiences, and sometimes they have a capacity to be able to deal with that and to cope with that, both within themselves but also within the military resources themselves. But sometimes they can't.
No.
And so that can create mental health problems. And it goes back a little bit to what I said before, which is the fact that sometimes we have an experience, and it's a bit like a computer file. When you get a piece of data and the computer doesn't know what to do with it, and so it just sits there, type of thing. And the more it sits there, it's almost like the stronger it gets, the worse it gets. Post-traumatic stress disorder is a little bit like that. It's like it's an old memory that the brain, because there's so much stress involved, is not able to file it away in the way in which it would normally do that.